Well, good evening, everyone. I'd like to welcome you to tonight's Ask the ARC webinar. My name is Carly Shortino-Poulter, and I'm the director of the ARC Advocacy Network here at the ARC of Indiana. And tonight is going to be a little bit different because we have turned this month's Ask the ARC into a virtual town hall. Because tonight we want to hear from you. We want to get your feedback on things. And so tonight we're going to be talking about waiver redesign, and specifically the state is starting to redesign the developmental disability waivers, which are currently the family support and the CIH waivers. But the ARC understands that, who should really be leading that discussion on on how these waivers should be redesigned? Well, it's those of us who use them. And so we want to make sure that individuals and families actually are able to give their input and their feedback on what they'd like to see in the waivers going forward. And so that's what we're going to do tonight. We're going to ask you all sorts of questions, and we're going to talk about all of this, and we want to hear your thoughts on all of these things. So we're going to have some guided questions, and we've been able to turn on the chat tonight. So as we talk, I'd like you to put your thoughts and your feedback into the chat so that we can capture this information and use that to help redesign those developmental disability waivers as we go forward. And so I want to start by talking about, what exactly is going on. And so, one of the things that people are asking us is, why is this happening? Why are we redesigning waivers? Well, anytime a state provides what's officially called home and community-based services, that's the official name for what we tend to call Medicaid waivers. A state has to actually get permission from the Centers for Medicare and Medicaid Services, or CMS, to provide those home and community-based services. The Centers for Medicare and Medicaid Services, that's the federal agency that oversees both Medicare and Medicaid. And anytime a state wants to provide a service or alter a service, they actually have to ask the feds permission to be able to make those changes. Well, when a state offers those home and community-based services, they have to submit a plan to CMS. And they either submit a plan for every 3 years or every 5 years. And Indiana tends to do that every 5 years. And those plans are incredibly detailed. Like literally, they're often, 300 pages or more. And in those plans, they detail who is eligible for waivers, who's going to be served on those waivers, how the state's going to monitor the quality of those services. But the important thing for us is that it also lists every single service that's going to be available under those waivers. It describes the service. It details what activities are allowable, what activities are not allowable, and also who can be paid for those services. And then also the documentation standards that the providers have to adhere to in providing those services. Now, in Indiana, we tend to request those services or those waivers for 5 years. And if we want to make any changes within those 5 years, we have to submit an amendment request to CMS to be able to make any changes. So there can be changes in between that 5-year period, but we tend to do it for 5 years at a stretch. And frankly, it's time for a new plan for the family support and the CIH waivers, because when you submit that plan also has an expiration date. And right now, the family support waiver and the CIH waiver expires on June 30th, 2025. So the state wants to make sure that we are putting together a plan and that we have plenty of time to make sure that it gets through the process and gets CMS approval before that expiration date. Because the reality is, if the state were to hit that expiration date, it's not that those services would continue until something new is in place, it's that all services would stop. So it really is important that we need to make sure that we submit a new plan and that it's a good plan. And that's why I want to talk to you guys tonight, and I want to hear from you tonight, because right now we are doing these waiver redesign town halls all across the state of Indiana so that we can engage with people with disabilities and with their families to find out what they want these services to look like. But we also recognize that not everybody can always make an in-person meeting at 6 o'clock on a weeknight. So we wanted to make sure that we had a virtual option so that people could give their input as well. We still have several town halls that have already been scheduled, and we've got more town halls that we are in the process of scheduling. We're just working out dates. So I do want you to stay involved and keep looking at those so that you can come to a town hall in person if you'd like to, if there's one near you. And so um, and so let's keep going. So what can we do? Well, it's that whole idea of nothing about us without us. These waivers are here to serve our loved ones. And so we want to make sure that as the state is making these plans, that they're actually keeping our loved ones in the forefront of their minds. And so we want to provide the feedback. What should these waivers offer? Who should qualify for these waivers? What's working well? What needs to be adjusted? And what needs to be either fixed or replaced in the waivers? Now, the state's philosophy is that all people have the right to live, love, work, learn, play, and pursue their life aspirations in their community. That's the guiding principle of the Life Course framework, and that's something that the state of Indiana has really adopted. And I want to point out here that it says all people have these rights, not just people with disabilities, but all people have these rights. And it's this philosophy that we should keep in mind as we're thinking about what types of services and supports we want for our loved ones to make sure that they have the ability to live, love, work, learn, play, and pursue their life's aspirations in their community. It's their lives. They should be the ones driving all of this. So now I want to go ahead and get into the meat of this. What do we want in life? What do we want in life for our loved ones? And not even just specifically exclusively thinking about the waivers, but what do we want for them in general? And sometimes that's easy. It's easy to think about the things we do want, but sometimes it's easier to think about the things we don't want in life too. So now I want to open it up and we're going to talk about this through the chat. And somebody did ask, they wanted to make sure that they understood correctly that the cameras and speakers were off. They are just, and that helps, keep things a little more organized because if you can imagine 66 people trying to all talk at once, it could get a little bit confusing. I do also want to remind you that we are recording this and it will be posted to our YouTube page shortly so that other people can also see this. But I want you to think, what are the things you want for your loved ones? If you're a person with a disability who's actually using waiver services directly, what are the things you want in life? So go ahead and put those ideas in the chat. So some of the things that we have been hearing are things like, people want to live independently. They want better transportation. I've got someone on here saying less meetings, maybe twice a year. Um, Someone else is saying meal delivery. That's something that has recently come up too. I'm going to be perfectly honest, guys. I'm probably not going to be able to share everything that everybody is sharing on the chat, just because the good news is we've got a lot of ideas coming in pretty fast and furious. So I want to make sure that we're sharing all of these things, but I probably won't be able to share all of it directly. Um, Somebody's saying they don't want what's happened with the aged and disabled waiver, and frankly, that's why we're doing these town halls right now. Is we want to make sure that people with disabilities and that families get to share their opinions and that they can amplify their voices to make sure that we're the ones who are driving this because it's our loved ones who use these services. And so, you know, we're the ones who are affected by this. We are the ones who live this every day. And so we want to make sure that we're the drivers here. Somebody else is saying the family support waiver is not enough to support individuals after high school that don't qualify for the CIH waiver. Somebody else, I'd like to see more opportunities for long-term respite and support. It's hard balancing my own life and my loved ones. I want her to have friends and spend time with her friends. I want her to be able to, I want to stay being able to be staff as parents. Less duplicate paperwork requests, art therapy, loving care, safe and secure care, pet therapy, um, being a parent and wanting to have long-term care for when I'm no longer around. Um, More options for supported living that's covered by waiver dollars. Okay. Um, More approved providers. The wait lists are very long. You're right. The workforce shortage is hitting hard here too. Consistent staffing and maybe provider ratings. Um, you guys are having some really, really phenomenal ideas here. And some that I've now done 11 town halls in person. And some of these things are really, really consistent. And some of you are sharing brand new ideas. So I'm loving this. Um, so, okay. And so as wow, we've got tons and tons and tons of things in here too. So I'm thrilled to see all of this. So, support community-driven efforts for integrated housing across the state. Somebody else is saying no managed care and no prohibition of parents or guardians to care for their loved ones. Waiver isn't enough for needed services. Unable to qualify for CIH waiver, even though the individual needs 24/7 care. Dance programs. Um, Access to the waiver without the extensive wait lists. Again, I'm seeing provider ratings. That's something that is a relatively that's something I haven't heard a lot about recently. Remove the requirement that the family support requires vehicle modification funds to actually come from the yearly budget. That's a real concern because when you only have a $26,000 budget for the family support waiver, that $15,000 is quite a bit. So you're welcome to keep putting in some of the things that we do want. Somebody else just added more mental health providers who have the ability to work with individuals with disabilities. Mental health needs to be addressed for our community. I could not agree with you more. Um, and so as you're thinking about that, I also want you to think about what are the things you don't want in life for your loved ones with disabilities. Are there things that maybe you have experienced or maybe that you're just afraid of for your loved one that you want to make sure we avoid? Go ahead and put that in the chat too. Oh, as I go a little crazy with my PowerPoint there. So now I'm gonna switch it up and ask, what are supports that we need that we don't have right now? So somebody said, why does it seem like only things are targeted for the more higher functioning individuals? Do our kids with behaviors not exist? There are a lot of people who feel like that there aren't enough supports available for those who have really high, especially behavior needs. I also hear that about individuals who have both medical needs, they've got the healthcare needs, but then they've also got those behavioral or just those intellectual needs too. And then it's really hard to find providers who will address who are willing to work with individuals who have both needs. Mental and dental care accessibility. We don't want our children housed in nursing homes. I don't want mine or anyone else's loved ones to fall through the cracks and not be able to have the care and supports they need. More accessible, affordable waiver homes. Safety systems. That's something we're going to get into a little bit later too. Educate the workers for respite because they don't know what's involved with helping a person with disabilities. Money for home repairs. So, okay. Um, okay. So I want you guys to keep adding all of these in because we're going to collect them and eventually what we're doing after we've completed all the town halls is we are going to put all of these together into a report that we're going to give to the Division of Disability and Rehabilitative Services to say, hey, here we've conducted these town hall sessions. Here's the feedback we got from people with disabilities and from families so that you can see what they want. Although I do also want to reassure you that all of the responses will be anonymous in the report that we provide. Um, I'm worried people making these decisions don't live with a child with special needs or not and are not fully aware what is needed to care for them. A lot of people agree with that. So So, what are some of the services that may be available right now, but could work better? So for example, um, there used to be a service called community habilitation. People would sometimes call it CHIO for short because that was the abbreviation, the budgeting abbreviation for it. And that was one of the broadest services out there because it was anything you would do in the community. And then there was a service called facility habilitation, which was done at basically at the provider's offices. Um, well, let's say you had somebody who was doing community habilitation, and their plan was that they were going to go play basketball with their friends. But then the heavens opened up and there was just a downpour. Well, under the old system, you wouldn't then be able to just change your plans and go back to the provider's offices and have a movie night instead because they were two separate services. And if you had community habilitation, you were not allowed to go back to the facility or to the offices to get those services instead. Well, during the pandemic, one of the amendments that the state submitted and was approved was that they combined those two services and renamed the day habilitation, even though you can do it in the evening too. But what that did was it allowed more flexibility so that if your plan was to go out and play basketball at the park, but then it started raining, you could go back and have a movie night at the offices instead. So that's kind of an example of, what services are available but could work better. So, so we need to have conversations about the difference between human rights and safety for those with higher needs. Some of our kids need protection from themselves, and it seems to be easier to say they have rights as a way to not address the higher needs. That's something that recently I heard that last night at one of our town halls, and that's something that isn't necessarily getting a lot of thought. So I'm really glad you brought that up. Have some money in the budget that parents can use for swimming lessons or other programs that they choose in addition to the waiver services. Um, Entitlement waivers for certain diagnoses, like SSI has compassionate allowance for certain diagnoses. Um, Our family needs a day program 5 days a week, but can only get 3 days a week. Then there's very little left for any other services. Guys, I am really, really glad that you are putting all of this in here. And some of these things we're also going to wind up addressing a little bit further on in the presentation as well, because you're absolutely right. And you guys are giving some really, really thoughtful answers here. So I want to switch up our topic a little bit here because the last time the state was about to redesign the waivers and they were planning on doing a pretty massive redesign was 2020. And back then, the ARC of Indiana, Self Advocates of Indiana, and the Indiana Institute on Disability and Community conducted town halls all across the state back then as well. And literally, our last town hall was the Wednesday before the world shut down. Um, and so a lot of those plans for changes were put on pause. Now, certain changes still went through. So, for example, some of the changes with case management and some of the other changes. There have been a few other changes during the pandemic. But the thing is, while we gathered that feedback 5 years ago, and we got some really, really good suggestions back then too, that we certainly want to talk about, but we've also had a life-changing pandemic since then. And I do think that for some people, their priorities changed. What they recognized as essential needs have changed, in part because some of the things that we used to be able to take for granted, we realized we could no longer take for granted. So now what I want you to think about is, what did we learn during the pandemic? What were some of your experiences? And I'll also say that some programs have actually made have actually made adjustments because of things we learned in the pandemic. For example, when the pandemic began, if somebody was on food stamps, they still had to go into a grocery store to purchase their food. There was no way to use their EBT card for to be able to order online or to be able to get grocery delivery or grocery pickup. Well, it wasn't always safe for somebody to be able to go into a grocery store at the time. And so the Division of Family Resources actually was able to make some adjustments so that they allowed an EBT card or that food stamp card to be used for grocery pickup or grocery delivery without that individual having to physically go into the store. So we were able to make some adjustments. But think about it. What were some of your experiences? What were some of the things we learned from the pandemic? And so, oh my goodness, I've gotten like 20 new responses since then. Um, let's see. So, um, so we've been continuing to get more information about what people want to continue or what services we need to either continue or create while on the waiver. Let me ask, how many people used used those delivery services, whether it was, grocery delivery or meal delivery, something like DoorDash or something like that? And is that something we should make sure that continues? Um, People are also talking about making sure that we continue to cover virtual sessions, whether it's behavior management over Zoom, whether it's, appointments with medical providers that can be done virtually. For a lot of people, being able to do things virtually opened up a whole new world for them. One of the other things that we learned early on in the pandemic. So Self Advocates of Indiana, when the pandemic first began, actually started having virtual sessions, and they initially started on them 3 times a week so that self advocates could stay connected and so that they weren't lonely, and trying to address some of those isolation concerns. But one of the things we learned was that a lot of individuals with disabilities did not have internet access through their homes. They would get online, but they would get online when they were at their day program or when they were in the community and they were using Wi-Fi. But we discovered a lot of them didn't necessarily have internet in their homes. Is that something we need to talk about? I'm seeing isolation is still an issue. Um, let's see. um, Hot food delivery and purchase with a family support due to lack of staff or family support for cooking. Um, Talking about using various types of delivery services, including things like Walmart Plus, Amazon, all sorts of things like that. People are also talking about, the ability to have those virtual appointments helps address a lot of those transportation concerns, and it makes it a little easier for families to be able to support their their um, their loved one in getting their needs met. Um, we need a place that we can take our kids when they are in crisis. Currently, there are very few places that will take our kids that are high behavior issues and nonverbal. The Affordable Connectivity Plan that gave free internet expired in April. Yes, it did, and I was not very happy when that happened, because that was something that could have been a game changer. Keep seeing transportation. Um, Support staff to accompany clients if meeting with the FSSA or Social Security. Okay, so as we talk about what we learned from the pandemic, and again, keep adding your thoughts in on this because you guys are giving really, really great information here. What are the things we learned that we actually need? Again, early in the pandemic, we had a lot of individuals who couldn't go to the grocery store because it just simply wasn't safe. But they also had elderly parents who couldn't go to the grocery store because it wasn't safe for them either. And so, we had providers who were literally going grocery shopping, for their clients and their families and dropping, those groceries off on the porch. You know, what are the and so that highlighted that need for things like delivery services. It highlighted the need for internet access. What are some of the other things that we learned that we need? Um, a source that continues to update us on availability of options. That is a great idea. And also, how many of you feel like you actually know what all is available under the waiver? Do you know that there are more than 30 different services available to you? Has anybody ever talked with you about all of that? Um, so what are some of the things that we've learned that we need? Staffing is one of the biggest things. Um, Rate increases for direct support professionals to be managed better. Um, Someone else is saying making sure that we're paying a livable wage so that we can attract good qualified staffing that stays so our loved ones have consistent staffing. Um, okay. Okay. Keep it coming, guys. What did we learn about the quality of life and what was important to us for quality of life during the pandemic? A lot of the things I've heard is how lonely people felt and how bad the isolation was. I also heard from individuals um, about, the conflicting needs in some of the waiver homes. You had some people who were working and they were deemed essential employees because they were working at a grocery store, and yet their housemate you know, um, was also at risk medically. And how do we balance those two needs? Um, Somebody else is saying it would be nice to have a little more information on providers before we sign the pick list. And it'd be nice if it was listed somewhere if they have staff before we reach out to the providers, because so many of them have no staff. Classes for parents and caregivers to learn how to deal with behavior issues and conflicts. Um, uh, Quality of services was poor during the pandemic. Isolation was bad. My son's sensory needs made wearing a mask a challenge, and he was left out of a lot of things. Um, Support groups for parents. Um, so please, absolutely keep adding all of this on. So I've seen a few people talk about case management, and I know that in the last few years, case management has had some changes. In fact, we've gone from about a dozen different case management companies, some of whom were very regional, to now we have six case management agencies who are statewide. Um, the state's intent was to make sure that case managers were acting more as a partner in the process, um, and making sure that case managers were trying to help families find additional resources outside of just waiver services, helping them find community resources, helping them identify those community supports. and other programs that could be available. Tell me what you think about case management. Case managers are overwhelmed with paperwork. Ratings for case management companies. Um, so tell me what you think about case management. Okay. Case managers can't do it all. When need navigators who can help guardians or parents who know all about the different services, who is good and who has staff on all of that. Um, Disappointed in that the case manager does not seem knowledgeable or able to provide information we need. There are quarterly meetings that don't accomplish much. Um, Case managers don't know anything about services for those with higher needs. They don't know anything about the CIH waiver. Um, I've got somebody else. I happen to have an excellent case manager, but I hear others saying their case managers know very little. So we have a lot of inconsistency with case management and with the knowledge of case managers. So we've got somebody else chiming in, better training for case managers. Um, so somebody else saying, why do we need quarterly meetings if there's nothing new to share? So keep going with that. And again, I'm going to abruptly change our topic again. And so the reality is, up until about 15 years ago or so, it was almost exclusively adults who had waiver services because, quite frankly, there was about a 15-year wait back then. At one point, the waiting list got as low as 6 months. Now we're getting close to 3 years again. But what that means, though, is that we do have children who are getting waivers, and we do even have infants and toddlers and preschoolers who are getting waivers. But a lot of the services are still designed a little bit more for adults. And so I want to talk about different age ranges, different parts of that lifespan to figure out what are the services that those individuals need. So for all of you parents on here, I want you to think back to when your child was really little. That 0 to 5 range. What were the supports and services that were needed when your child was really, really little? So, um, so somebody said we waited 2 years with a child who was diagnosed at 14, then the pandemic and delays, and by the time we got services, we blinked and we've been told we are losing them before we've even used much. Give us a call, my dear, because I think give us talk to one of our family advocates because we'll help you out with a lot of these things. Um, Services needed at that 0 to 5 range, respite. But somebody else is bringing up behavior supports because yes, even at in that 0 to 5 range, we have some behavior issues that we need to talk about. Qualified behaviorists, speech and language therapists. Um, let's see. Um, I currently have a 16-month-old and I'm very thankful for it with all of her medical complications. Support staff. Somebody else took 9 years to get the family support waiver. I feel that. I was there with my son. Same thing. Um, so, you know, I mean, I'm seeing therapies. What about in that 0 to 5 range? What about play skills? Would that have been something that would have been helpful for your child? Somebody else is saying sign language classes. Um, I'd even broaden that up and broaden that to any type of communication supports. Respite for caregivers. Um, what about um, oh, somebody's saying uh, more things covered to help with kids' sensory needs. So sensory toys, sensory therapies, things like that. Somebody else is saying, is talking about making sure that people have access to doctors and doctors who actually understand disabilities. Um, Outside the box therapies like hippotherapy, which is therapeutic horseback riding, aqua therapy, respite, play, and gym memberships. Let me ask too, when our kids were little, for a lot of us, for some of us, the diagnosis was brand new, and was a surprise. Would supports for the family be good? Supports to help parents understand what the disability actually is, what it means to have a child with a disability, but then also therapy to help them learn how to actually support their child. And it's not that parents can't figure those things out on their own, but frankly, if you could have some help figuring it out, wouldn't that be better than trying to have to do it all on your own? You tell me, what do you think about that? Figuring it out on your own sucks. I totally agree with you. I was very lucky when my son entered preschool, when he entered early childhood. Um, we were very lucky. We had a wonderful preschool teacher. So I'm totally giving a shout out to Miss Kate from South Bend School Corporation, um, because she not only helped our son and helped him grow and helped him learn coping skills and helped him learn communication skills. She taught us what it meant to have a child with autism. She taught us how to help him. She taught us how to sort through all of that. So she provided as much support for us as she did for our son. Is that something that would be helpful at those really young ages? So keep adding your thoughts in here, and we're going to go to that next age. We're going to talk about those grade school kids, the kids 6 to 13. What are the supports that they need? Um, some of the things that we think of are things, you know, like continuing to learn play skills, but also social skills. I'm seeing some people talk about communication skills and how to interact with their peers. Um, Somebody just said internet safety. Absolutely. More activities for individuals with special needs. For example, soccer teams, especially for kids with ADHD or kids with autism. Um, Seeing a lot of information, a lot of responses about the school system and what schools can provide more. Self-advocacy skills. I am so glad that you said that. By the way, some of you are seeing some of these responses, some of you aren't. It all depends on whether the people are posting their responses to everyone or to just the hosts and the panelists. So I'm probably seeing a few more things than some of you are, but we're getting a lot of really great information here. Access to social opportunities, clubs and camps, and after school programs. That's another thing. So a lot of after school programs only go up to age 12. But first of all, for our kids, sometimes they need we need to make sure that they have appropriate after school care. Because if you've got a kid with autism, with sensory issues, putting them in a room full of 35 kids probably is not the best option. But while a lot of typical kids may age out of the need for after school care at 12, our kids with disabilities may still need that additional support. Would that be something that would be helpful? Is more after school programs, um, more diagnostic testing available, and easier to get diagnostic testing. Let me ask you this, because I talk to a lot of people with disabilities and a lot of adults with disabilities, and a lot of them don't necessarily know what their disability is. Would it be helpful, especially at this age, to make sure that these children with disabilities actually learn what their disability is and understand that to help lead with that acceptance of their disability, but also to help give them the support that they need? It's that something that would be helpful. Um, you know, Do we still need, as parents, do we still need support at that point? What about support for the siblings? Do we want waivers to be able to provide support for the siblings as well? Because there can be a lot of sibling-based issues. Okay, I'm seeing a lot of people who are saying yes to that, and more support for single parent families. Absolutely, absolutely. Um, as a sibling whose both parents have passed away, I need a lot more support caring for my special needs sister. Um, okay. Now let's talk about those the transition aged youth, those 14 to 24-year-olds, kids in high school and right after high school. What do they need? I'm seeing social skills because that's something we want to keep moving on. I see somebody else, a plan. I hear you on that one. Job training. Um, someone to hold my hand. It's scary in transition. So support for that, for those parents to make sure that so that they don't feel alone. Um, after high school, somebody after high school, the supports stop. It is harder to find supports after high school. What about things like, we've talked about job supports. Okay, somebody's adding it in, and things are coming in faster than I can read. Independent living skills, things like money management, things like cooking, things like laundry. Um, let's see. Um, support for those adults who may have some family supports but require way more support than that. Um, long-term plans. Believe it or not, this might be this would be a time to start thinking about, that future planning and what is life going to look like, especially after the school bus stops. We've seen social skills, we've seen independent living skills, more knowledge about medical things like medications that they take. Yeah, because this is a time where all of that is in flux and it's needing a lot more updates because they're changing so much. Housing options, legal services for the parents, especially when it comes to different levels of support. What about, and I know that this is going to be a controversial topic, what about relationship supports? Because I talk to a lot of self-advocates and they want to have relationships. They want to have girlfriends and boyfriends. They want to potentially get married. Would How would you feel about services that could help them, build healthy relationships, recognize what healthy relationships are and how to support them in that. Help them learn about consent, that they are allowed to say no and they're allowed to say yes if they'd like. Um, what do you think of those sorts of things? Again, I'm seeing a lot of job skills. I'm seeing a lot of housing options. Um, having more medical providers through Medicaid. Um, so seeing a lot of really, really great ideas here. So somebody said earlier with the younger kids, self-advocacy skills. Don't we need those self-advocacy skills here? So I'm seeing yes, yes, absolutely. Okay. So, um, let's switch up to our adults. Our 25 to 50-year-olds. And yesterday, in one of our sessions, somebody said, you know what? That is too big of a span. Because what a 25-year-old wants and what a 50-year-old wants can be very different things. She said, when I was 25, I wanted to go out all the time and I wanted to do all sorts of things. I'm closer to 50 now. When I'm done with work, I want to come home and put on my pajamas. Okay, that was totally fair for her to say that. So let's broaden it up a little bit more, but what do our adults need? I'm seeing financial management, teaching them how to manage their money. I'm seeing independent living skills and housing supports. Let me ask again, is this where, do we need to, shouldn't we start those future planning discussions now? That planning for what happens when we as parents aren't here anymore? What does that next um, phase of support look like? Um, I'm seeing somebody talk about making sure they have more financial supports so that they can save money and do more things. I do see one person that says only up to 50. Why are we stopping there? Because we've broken up the other ages in a couple more slides. So we'll get there. Um, but here we're just kind of starting to think a little bit more about those adults, more housing options. Um, a middle waiver. The family support waiver is not enough for those who can't work or are out of school. Mentor support, mentors, buddies, communities. Seniors have senior centers for community. We need that. We need more to be included. Making sure people can have friends. Um, she spends a lot of her money on Uber because the special needs buses are doing the day programs at the time she gets off work. Transportation is huge for her. Self-acceptance and self-advocacy skills. That's a good one. That's something that I haven't heard yet before. Working on work relationships and home maintenance skills. Um, let's see. Emotional maturity, um, literacy. That's one of those things too, is, for a lot of people, once school stops, some of those academic skills regress. So do we want to make sure that they have the ability to keep up on that? And or do we want to make sure that they have options for some technology that may be able to help them? So, okay, seeing more and more. Emotional regulation. Uh-huh. Okay. We're gonna more representative payee options. Yes, absolutely. But I'm also going to add in there, what about trying to make sure that we're teaching people about money and money management so that maybe they don't need a rep payee and they may be able to manage it on their own, even if that's not necessarily doing all the math and things themselves, but maybe using some apps or some other technology to help with that. Less financial restrictions. Okay. So I told you we were going to keep going on with different ages. So here I have 51 to 60, and I know that I'll be perfectly honest, that's totally arbitrary on my part. But my thought process here was that, that's when we start seeing some more of those medical needs that are changing. We start to see the beginning of some of those age-related issues. So for those individuals between 51 and 60, what are some of the supports that they need? I'm seeing medical supports, retirement planning, absolutely. Doctors who understand the needs of people with disabilities. Doctors who will talk with people with disabilities so that they understand. Is that something that's important to all of you? End of life planning. Um, the medical community does not know how to help our individuals. How often do you take your loved one to the doctor and the doctor only talks to you and never actually talks to the person with the disability? Have you ever made sure to redirect it so that when the doctor says, "Does his tummy hurt?" making a big exaggerated show of it, "I don't know. Andy, does your tummy hurt?" So that the doctor remembers, "Oh, wait, that's my patient. That's who I need to be talking to." Um, let's see. Medical needs and slowing down, and more funding for DSPs as their needs increase. Um, let's see. End of life discussions. more equipment. So for example, if somebody begins to need things like a walker or a cane or something like that, that they've actually got the ability to get those things. Um, so, okay. S- wait. Exercise programs, healthy food and meals, building financial skills, stress management skills. Here's another one. What about grief counseling? Because as you're getting that age, you're losing friends, you're losing parents, you're losing other family members. But for a lot of our loved ones, it's very difficult for them to find grief counseling. Is that something we want to make sure is on there? Um, so the reality is, it's probably only been in the last 20 years or so that we have started to think about age-related issues because in the past, people with disabilities often didn't live long enough to face age-related issues. The good news is now they are, but we also haven't figured out what to do about those age-related issues because it's brand new. So, what are some of the things that older adults with intellectual and developmental disabilities may need? I'm still seeing grief counseling for with people who understand people with developmental disabilities, and also I'm seeing grieving for pets who die. Um, so yeah, absolutely. So somebody's asking, is there actually funding for more options with the waiver? We know the billion-dollar shortfall that Medicaid faced. You know what? My personal opinion on this is let's shoot for the pie in the sky. Because if we don't ask, they're definitely, if we don't ask, we're definitely not going to get it. The worst they're going to say is no. So we're gonna shoot for the moon here. Um, will there be time for miscellaneous questions and concerns? Uh, I will certainly try to make sure that we do. And you can also always call and talk with our family advocates here. But what are some of the other age-related things we see? I'm seeing more of that specialized medical care, um, funding for support animals, including disabilities and clinical training programs. Okay. Funding for house repairs and maintenance, especially to keep homes safe. Um, one of the things we were discussing last night was that, a lot of individuals with disabilities wind up living in rental homes. And so, home modifications aren't always the best use of those funds because they're not always going to live there. So we want to make sure that people have accessible and affordable housing. Rental assistance for individuals who can live in aged care facilities. Um, so, okay. All right. By all means, keep adding to this, but I'm going to abruptly change our subject again. So the last time the state was looking at changing up the developmental disability waivers, one of the ideas that they were floating was the concept of participant directed goods and services. That's allowing individuals to use their waiver dollars to purchase goods or services that helped with their disability that Medicaid just doesn't cover. So some examples of some of those goods could be things like equipment or tickets to events or security systems or video doorbells. Some examples of services could be things like housekeeping or gym memberships or subscriptions. So, first of all, let me officially ask, do you like the idea of participant directed goods and services? And then, if so, what are some of the things you'd like to see people be able to use this for? Um, so, housekeeping, participant directed care. That's something we'll get into here in a little bit. Um, So what about things, because transportation is one of those topics that comes up quite often. What about being able to use your waiver for transportation? And I know on some levels you can, but what about also being able to use it for things like Uber or Lyft? And I will tell you, some case managers will tell you you can absolutely use it for that. Other case managers tell you no, you absolutely cannot. And so I think that kind of highlights the discrepancy in the knowledge and understanding of case managers too. I'm seeing housekeeping, safe cell phones, smartwatches. Is this, I said earlier that we learned a lot of people with disabilities did not have internet access in their homes. Should their waiver be able to pay for things like internet access or cell phones? Because a lot of government programs tend to think of those things as luxuries, but phones and internet aren't really luxuries anymore. Those are essential utilities. Should people be able to use their waivers to pay for that if they don't have the funds to pay for it themselves? Um, let's see. Participant-directed funds would be good if there isn't a ton of red tape and uncharges. The waiver now affords specialized medical equipment and home modifications, but the ability to get them is so cumbersome and the fee is crazy because it's been unchanged. That I tend to tell people, there is a difference between the way things are supposed to work and the way they work in real life. So I am grateful to hear that feedback on the real life part of it, hearing about you know, how burdensome it is to try to be able to get things like home modifications or something like that because of all of the administrative barriers that are put in place. That's really important things to know. GPS trackers would be great. Gym memberships, mental and physical health. Um, let's see. Somebody's saying personal trainers, medic alert systems. Um, let's see. Okay. Um, workshop fees, internet access, gym memberships. That does bring up a really good topic. What about things like classes? Like, let's say somebody wanted to take an art class or they wanted to take a music class. And here I'm differentiating between music therapy and actually learning how to play an instrument because those are two very different things. Or maybe somebody just wants to take a cake decorating class because they really enjoy that, or they want to take a cooking class or something like that. Should they be able to use their waiver dollars for that? Using money towards purchasing an accessible vehicle that is already modified and not just on a pre-modified vehicle. Um, so the reality is, trying to buy a wheelchair accessible van is incredibly expensive. So, should people be able to use their waiver dollars for that, or should we somehow make it easier for people to be able to save the money so that they can purchase those things? Now, the state has made a few changes recently. So, for example, they've recently changed vehicle modifications because it used to be that there was a lifetime cap on how much money you could spend on vehicle modifications. Vehicles don't last a lifetime. So, effective July 1st, the state adjusted that so that now it's a 10-year, every 10 years, you can get vehicles modified. It's a 10-year cap instead of a lifetime cap. So those are the types of things, especially earlier when we were talking about what could be changed to make things work better. I've seen, somebody talking about, reducing the administrative barriers for things like home modifications and things like that so that you can actually get those services easily and quickly. Um, so sorry, holy cow, as we've been talking, we've gotten 42 new messages. Um, so let's see, I'm trying to uh I'm trying to see some of these things. What about things like being able to use your waiver to buy technology? Like computers or tablets, or smartwatches, or things like that. Should you be able to use your waiver for something like that? What about, while there are a lot of free apps out there, there are also some apps that cost money or that have a monthly subscription. And don't get me wrong, I'm not talking about, using your waiver to buy V-Bucks for Fortnite, but should people be able to use their waiver to purchase apps or have a monthly subscription that helps them with something related to their disability? Is that something we want them to be able to do? So keep adding those things in here, because I know that those are ideas that are going to keep coming through. I want those to keep coming through. Somebody's talking about, being able to buy noise canceling headphones. Um, so so yeah, and somebody else is pushing back on my Fortnite example. I completely understand, because yes, those types of things can also help with stress reduction. Totally understand. I totally understand you there. Um, so keep adding some of those things. But let's also talk. What changes would make the waiver easier to use? We've had some people talk about, reducing the number of meetings. We've had people talk about reducing the amount of paperwork that we have to do. Some people talking about having somebody to help you with all of that paperwork. Um, Having specific goals, life goals that you're working toward. Um, so what are some changes that could make the waiver easier to use? Online access to pick lists with reviews from other users. Um, Reduce the amount of paperwork and the multiple application process. Um, Access to information. Okay. Um, Pick lists with more information that are easier to use. Plain language, images and short videos to explain the processes. Um, Case managers who help to find different provider agencies, a company that can actually provide the services that are needed for a client. Um, so I just hope they don't take things away. The A&D waiver renewal is going to be a way to deny services because it's managed care. I've already had stuff denied, and my caregiver hasn't been paid since June 30th. I'll be honest, especially with the changes in the health and wellness and the pathways for aging and the TBI waiver, there's still a lot of confusion and a lot of questions. And so, we're hearing a lot of that feedback. We're talking to different state agencies to share with them what we're hearing to try to fix some of these things too. Having navigators or people or organizations that can provide information on community resources. Case managers can't do everything. Somebody's agreeing. I love the online access to choice lists and provider reviews. Um, Case manager consistency. Um, let's see. An easily accessible online directory of eligible waiver expenses. Accountability of providers. Those with higher needs feel like they can't complain and have to take what they can get. That's not a good position to be in. Um, so let's see. The principle is that there would be 90 days of service that would not change, but in practice, everything just kind of came to a halt. Again, that's referring to the pathways and the health and wellness waivers. Um, okay. What services need to change to make them easier to use? I want you to think about that. Transportation. Okay. Let's see. No, more oversight for provider billing to prevent fraud. Um, Unable to find providers who can staff evening and weekends. More adult services. Environmental modifications need to be changed to make them easier to use. Um, so more quality day programming. Uh, the need for DSPs. So many agencies simply do not have staff. So how can the state ensure quality of services? We're starting to get some you know some comments along those lines. How can the state ensure quality of services? I see somebody saying I see somebody saying you know ask them. Okay, that's a great point. How often should they ask? So somebody's saying at the quarterly meetings. Somebody also brought up the idea of a DSP registry. So if you're talking about a DSP registry that registers DSPs who have been where they have substantiated allegations of abuse, neglect, or exploitation. That did finally pass. They are still working on the creation and implementation of that, but we did get legislation passed to actually create that registry so that we can try to ensure um, that DSPs who harm individuals don't just hop from one agency to another. Um, Making a way for families to be honest anonymously. You know what? That's a good point because a lot of families are afraid to speak up because they're afraid of retaliation or they're afraid of their agency serving notice when they can't find other provider agencies for their loved one or they live in an area with very few options. DSP training, not just warm bodies. So, okay. How can the state ensure that services improve quality of life? What can they measure to help with that? And I know that that's a really hard question. So sometimes I'm bad about asking those hard questions. Somebody's also bringing up the concept of DSP certifications from the state that and pay levels that will recognize the level of skill and knowledge necessary to be a good DSP. That's something they worked toward in the past. That's something that there are some pilot projects that are trying to go back to that. But that's a really good point, and I'm glad you brought it up. Um, Getting back to the ensuring services improve quality of life, asking the families about their satisfaction. Um, okay. So one of the things that kept coming up, and I wasn't addressing it yet because I knew that we were addressing it now, what was that concept of how many waivers we have and what is enough and things like that. So that's what we're going to start getting into right now. So let's talk about the current waivers. Currently, we have the Community Integration and Habilitation, or CIH waiver. That is an emergency-based waiver. The budget for for the CIH waivers are based on the individual's need. As of June 3rd of this year, there are 9,095 people on the CIH waiver, and they get about 700 to 800 applications for the CIH waiver every year. And yes, most of those are denied. On the family supports waiver, we currently have, as of June 3rd, we had 23,564 individuals on the family support waiver. And we have 7,631 people on the waiting list as of June 3rd. And they were current, and at that time they were targeting people who signed up in September of 2021. So we're getting closer to having a 3-year waiting list for that waiver. There are now 3 priority categories to get on that family support waiver. Individuals between 18 and 24 who have finished school can request priority status and get on the family support waiver. Be children of active duty service members and veterans. And even though I say children, they can be children over the age of 18, but the children of active duty service members and veterans can request priority status. And effective July 1st, there was a new priority status. So if we have somebody who's on the health and wellness waiver and they no longer are eligible for the health and wellness waiver because their medical condition improves, but they would be eligible for the family support waiver, they can request priority status. And instead of going on the waiting list, they can start services right away and just transition from one waiver to the other. The family support waiver during during the pandemic was actually put online. It is much easier. It takes all of 5 minutes to fill out. The two hardest parts about that application, in my opinion, are tracking down your kid's social security number and remembering that every time it says you, it really means your loved one. So yes, they are asking for a 4-year-old's marital status. Um, the good news is it is online. It is a whole lot easier to apply. The other side of that is the state is expecting 9,000 new applications for the family support waiver this year alone. So that's the current status on our waivers. Okay. So when we were talking back in 2020 about waivers, the state was asking how many waivers should we have? And they were floating the idea of a medium-sized waiver. But I'm going to, open that back up to you. How many waivers do you think we should have? Do we stay with just the two waivers? Do we create a third waiver? Do we do something else? So so tell me what you think. How many waivers should we have? And along with that, what should the smallest waiver include? Somebody earlier said that that a waiver should at least cover a 5-day-a-week day program. Do we want to make sure that behavior management is still available even with a 5-day-a-week day program? What are the minimums? What should the smallest waiver include? And so let's see. Um, let's see. We need something in the middle if they're not going to offer a middle of the road budget. Um, the smallest waiver should at least cover VR. So VR is actually a completely separate state agency and a completely separate set of services. Now, if you're talking about employment supports in general, some new flexibilities went into effect July 1st on both the family support and CIH waiver. So they added flexibility to 3 current services to help provide more employment supports. And they actually created a brand new service called Career Exploration. Um, there's another couple of words in that, but it's a career exploration service so that people can learn more about different employment opportunities. So if it's just about providing additional employment supports, some of those things went into effect July 1st, and a lot of people don't know that yet. But if you're actually talking about VR itself, that's actually a separate funding stream. And the good news about that is it means it does not come out of your waiver budget. So that's why I wanted to kind of focus that or make that distinction there. Make a waiver for higher needs and pay providers willing to take those clients at a higher rate. That's something that I've heard of. It's for individuals who have high support needs, whether it's high medical support needs or high behavioral support needs, it's harder for them to find providers, and maybe we should incentivize providers with a higher rate reimbursement to get them to take more of those clients. Somebody's asking, what does each waiver do, and what does a medium waiver mean? So I'm really glad you asked that. So for the most part, the services on the family support waiver and the CIH waiver are mostly the same. There are a few services that are different, but they're pretty, there's more overlap than differences there. The biggest difference between the family support waiver and the CIH waiver or a medium waiver is how much is in that budget. So for example, right now, the family support waiver has a waiver budget cap uh, of $26,482 a year just in waiver services. And that has gone up during the pandemic, in part because we were increasing the rates that the provider agencies were getting. And so the state made corresponding increases in the budget so that nobody would wind up losing services because they were going to be paying people more. So they wanted to make sure that nobody lost services that way. At the CIH waiver budgets, um, I don't know for sure what the average CIH waiver budget is. Um, when you have a CIH waiver, they look at your needs, they look at your age, they look at your living situation. So do you live at home with family? Do you live in a house with other people with disabilities? And they take all of that, and then they do an assessment called an ICAP. Um, and I'll be perfectly honest, I cannot remember what ICAP stands for. It's inventory, and I can't remember the C, and agency planning. But I can't, but it's an assessment of a person's abilities. And they use that information about, like, your living situation and your age and then the results from your ICAP. And they put those results through an algorithm, and they come up with what they call an algo score. And you can have anywhere from an algo score of 0, where you have very, very basic needs, to an algo 6, you have extremely high needs. Um, for a long time, an average algo score was an algo 2. And every algo level has a word associated with them, and an algo 2 was regular. You have regular needs for a person with a disability. I know that I have some case managers on here because I have seen them and I recognize their names. If one of you case managers can chime in here, what is if you can give me kind of a range on an average Algo 2 budget. I know what I think it is, but I might very well be wrong, and I don't want to give that wrong information. So if one of my case managers can kind of chime in and tell me, is an average Algo 2 budget at this point, is it about, in the $40,000 range for services? What does that look like right now? And I was hoping somebody might chime in. Suddenly everybody's quiet. Um, but that's what we're talking about when we're talking about, the smallest waivers, and what is a medium waiver. There we're talking about, the money available or the budget available for those services. Okay. Somebody's asking, how do you find out your algo score? Well, first of all, you only have an algo score if you're on the CIH waiver, and you can ask your case manager that information. They would absolutely be able to tell you that. And they'd also be able to tell you what your budget for services is. And if you're on the family support waiver, your budget is $26,482. Okay. By the way, um, the state does have the family support and CIH waiver manual online. And again, that's where it lays out every single service that's available. What does that service look like? What's allowed under that service? What's not allowed under that service? And also, just as importantly, it also lists what the rates are for each of those services, so that you can try to maximize the services that your loved one is getting. Somebody's asking where we can find the manual, so I'm going to ask and ask to crowdsource this. Would somebody be willing to find that link and put that in the chat as well, so that everybody can have access to that? There we go. Thank you, Chris, for putting that in there. I really, really appreciate that. So that's just it. We families got to stick together, because we're the ones who really do help each other out with all of this. And that's not a slam on the professionals that I have on here too, because the fact that you're here shows that you actually care about all of this, and really do care. So when it comes to those waivers, what is good enough? I had somebody tell me the other day, There is no such thing as good enough. Why should we settle? That's a very, very valid point. But what are the things we want to make sure that our loved ones have available to them to help them live their best life? So let's get some of those things in there. Respect. I'm going to throw in there dignity along with that. A lot of times, especially our adults with disabilities, are often still treated like children. Regardless of what their ability is, they're not children. They're adults and they deserve the same respect and dignity that everyone else gets. A true advocate. People with disabilities want the same things everyone else does. They want to live their own lives. They want someone to love. They want friends. They want their own homes. They want to make their own money and control their own money. Absolutely right. So, all right. So last one, because I know that we are over time. Oh, somebody said vehicles to learn new skills, and I know that I understand what you mean there. But you brought up something else, and this was something that somebody has brought up in another town hall before. Um, driver's ed. Is that something we want our loved ones to be able to use their waivers for? I know you didn't actually mean cars in what you said. You just sparked that idea in my head. So so I will thank you for both of those. Um, so all right. All right. I see people chiming in. Yes, they think that's a good idea. Um, Somebody said, yes, I was told there was a service through VR to learn to drive. That's absolutely true. If VR says that you need to be able to drive for the job that you want, they can help with driver's ed. So you are absolutely right. So, so one of the other topics that has come up is something called self-directed care. Currently, that is available on the health and wellness waiver, the Pathways for Aging waiver, and the Traumatic Brain Injury waiver. And so bear with me as I kind of describe this. Self-directed care is where the individual or the guardian finds, hires, and trains their own staff. They basically act as the employer for that staff person. Now, Indiana contracts with a company who essentially handles all of the HR stuff. They handle the workman's comp paperwork, and the taxes and the payroll, and all of that. But as the individual or as the guardian, you are the one who finds, hires, trains, and retains your own staff. And so it basically kind of takes the provider agency out of the loop. Um, with self-directed care, the entire approved rate that would be paid to a provider agency is paid directly to that staff person instead. Okay. Now, on the developmental disability waivers, the family support and the CIH waiver, they don't yet have the infrastructure designed to implement that yet, but it is something that they've been talking about. And so one of the questions is self-directed care something that you would be interested in? Would, knowing that you would have to be the one to find your staff, to train your staff, and to act as the employer, um, but that you may be able to find more people simply because it is a much higher pay rate. Is that something that you would want as an option? Um, So let's see if self-directed care would be great. I've used it for myself for 15 years. The new uh, the new A&D changes have messed that up too. It's so much easier to hire caregivers rather than go through an agency. Okay, I'm thank you for sharing your experience with this because this is a new topic on the developmental disability side of the world. So I'm glad to hear your perspective on this. So, um, So let's see. Here we're talking, I'm seeing a lot more on that future planning and things like wills and trusts and estates. Um, Self-directed care is what I did for my son because there wasn't any waiver staff available. Um, let's see. This is a slightly different topic, but I think it's an important point. I think the scope is getting a little off. If we ask for things like driver's ed, we are talking about individuals high functioning enough to drive a car. My fear is that the powers that be will only add these kinds of things and still not do anything to help those with higher needs. I think that you are right that we need to make sure that we are, when it comes to people with disabilities, we have such a wide variety of needs and abilities. And we need to make sure that we are addressing the needs of everyone and not excluding somebody, whether that's excluding individuals who have really high needs, where it's more difficult for them to find supports. At the same time, those individuals um, who have, more abilities and who are able to do a lot of things, they also feel left out a lot of times because it's harder for them to find resources too. So we've got to make sure that we're not focusing only on one on one group and where we might wind up excluding others. So, somebody else, I love self-directed care. I hire through Ball State students, nursing, special ed, speech therapy students. Um, Somebody else, that sounds overwhelming, but I like the idea of being able to offer them more money. I think that's a fair comment. Um, I like the concept, but would you have to make sure you're compliant with state requirements? Yes, you would. So like, they're still going to have to go through those background checks. They're still going to have to follow all of the state rules, things like, making sure that they are CPR certified, making sure that all of the normal just employment paperwork in general is done. And like I said, on the health and wellness pathways and TBI waiver, there is an agency that the state has a contract with. It's PPL First, and they're the ones who handle all of that paperwork and all of those HR type services for that self-directed care. Um, the restriction is still there on legally responsible individuals. Absolutely. When it comes to self-directed care, you still have that restriction on there. Self-directed care would be very good for some of the families I serve. I believe it should be an option. Um, Yes, I feel that the higher functioning individuals say what they want and don't want, and our adult kids with behavior issues are overlooked and don't get the services that they need, except from us as parents. Um, I think there are a lot of people who feel the same way. Let's see. People talking about how difficult it is to get that CIH waiver, even when you have really high needs. Somebody else, self-directed care would be great. The state would have to put the DSP directory online so we parents could access it. The DSPs would have to be vetted first before being put on the directory. It makes much more sense because there could be DSPs living in my neighborhood now, but I would not know about them unless they worked for my provider. So, and I think, one of the ideas behind self-directed care is that you're recruiting your own staff. So as somebody pointed out, they actually tend, I'm guessing they probably live near Ball State. And so they go and they recruit students at Ball State and specifically students who are, who are in college to become special ed teachers or speech and language pathologists. Maybe even some of the behavior therapy students could be options there too. Let's see. Let's see. Somebody else, it would be nice to have safe housing options for our adult kids that have behaviors. I would like to get my son in a house and used to living somewhere else besides with us. so that as we age, I know he's in a good place. And that's part of that future planning, that's part of that future planning, process. And is that something that we want to make sure individuals and families have support with? Because I wind up talking to families where the parents have passed away, and then all of a sudden that individual is being told they need to move in with a sibling. And it's not that they don't love the sibling, and it's not that the sibling doesn't love them, but now they're grieving the loss of their parent, but then they've also lost the only home they've known. They oftentimes they're moving to a new city, so that they're losing a lot of their natural supports. They're losing all of their friends and the community that they've built. You know, we do we need to make sure that there are ways that we can make sure that we're doing that more deliberately, so that we don't do that. One of the other things is that you te you tell me, to me, it feels like oftentimes the state doesn't try to deal with things until something reaches crisis point. Should we intervene far before we get to crisis and not make sure and not wait until we're at crisis before we start addressing issues? I say rhetorically, because do I really expect any of you to say no? Of course not. Um, so what happens when the person setting up the self-directed care passes away? Well, the way self-directed care works right now on the health and wellness and pathways and TBI side is that oftentimes it's the individual themselves who are setting it up, just because on that side more often there are fewer guardians in place than there are on the developmental disability side of the world. So that's not normally an issue. If you're talking about if it's a guardian who's setting that up, well, when that guardian passes away, there has to be a new guardian put in place, because guardianship does not end when the guardian dies. It's about the fact that that individual has been declared a protected person. But I think that's part of that future planning process, and making sure that there are supports and that there are additional people, and building that network of support so that they have others who can help them out with some of those things. But at the same time, that's something that you consider with self-directed care. So yeah. All right. Well, ladies and gentlemen, I want to thank you for all of your thoughts on this. And we still want to hear your thoughts, because if you're anything like me, you're going to think of something like 3 weeks from now. We want to make sure that you are still able to share your input. So you can always email us at info@arcind.org. So that because this is something that is going to continue for a little while. We want to make sure that families and that people with disabilities get to be that driving force behind these waiver changes. Now, I know that earlier somebody was asking, hey, are you going to allow time for some questions? This is a good time to go ahead and ask those questions. I will say we don't necessarily have a lot of information right now. We've been asking for some information, and the state has said that at the next DDRS advisory committee meeting that they will start addressing some of those questions and talk about what they're thinking with waiver redesign. That is a meeting that they do stream online. So Oh, I have no idea how to find it. I'll be perfectly honest. There's normally a link on our website that will get me to it, and that's what I click to get to it when I remember when I remember to do that. The next DDRS Advisory Council meeting is August 21st. I believe it's at 10 a.m. That is what's going through my head, but I'll also be perfectly honest, I am pulling that off the top of my head. Um, how much warning will we get if and when the changes are made? Um, that's a really good question. Oftentimes, what they will do is they will put out the plan, and then they will publish the plan for public comment. And typically you have 30 days for public comment. Then they will take all of the comments that they get. They will consider all of the comments. Sometimes they will make changes based on the comments. Sometimes they won't. And then they will put out an I'm going to say an updated plan, for lack of a better word, that again goes out again for public comment. Okay. Um, I don't know when they're going to submit that plan to CMS, and it's when they submit that plan to CMS, that's when it goes out for public comment. Um, but that's something that, you know, we at the Arc of Indiana are going to make sure that people are staying up to date on all of this. That's why we're doing these town halls, is so that we can gather all of this information, and provide it to the state to say, hey, here is what self-advocates and here's what families want in these waivers, so that they can incorporate that into the plans that they submit. So, um, let's see. Uh, is the plan based on notes from these town halls? I'm going to say I hope so. That's my goal. That's my goal with this, is to make sure that the state is actually getting more recent feedback. They're going to look at the feedback that we collected back in 2020. And again, there were some really good ideas back then. So that's a good thing. They have been doing pilot projects for the last few years on a lot of different things, everything from grief counseling and spiritual support, peer mentoring, and a lot of different things that they've been trying, and they've done little pilot programs for. They're taking the results of those pilot programs to see, hey, is this something that we think should be good, and is this how we want it to be arranged? So they're gathering a lot of information in a lot of different ways. We just wanted to make sure that self-advocates and families could more directly say what they wanted and what was most important to them in this process. Um, let's see. Is Somebody's asking, and I'm kind of paraphrasing the question here. Is there a chance that people will be taken off the CIH waiver, um, and not offered as much? I don't think that that's not anything I have heard. And so don't get me wrong, I know that that's always a fear. That's not any of the feedback I'm hearing right now. Okay, but it's something, if we ever heard something like that, that's something that we would certainly share with everybody, and certainly something that we would be addressing. Okay, so I understand the concern with it. But no, you've got a partner who's going to be watching out for things exactly like that. Um, Let's see. I've downloaded the life course program, and I believe case managers are trained in it, but they don't have time to meet and develop it. Any suggestions? I kind of agree with you there. And I will say that I do it periodically just with my son myself, and we update it, um, either when situations change, like he had been working for about 2.5 years, and then his employer went bankrupt and closed all of their stores. So we updated then, and then we also try to update it at least once a year, because as the things we want in life change, and so we want to make sure that we're updating. But yeah, that's something that I do directly with my son, and then I share those results with his waiver team. Um, See, I hope that the consumer input in the waiver redesign is listened to more than the A&D waiver was. I felt like the plan was already in place and the consumer input was just window dressing. It was very, very sad and frustrating. Um, you know, it it was it was one of those things where the plan that was submitted for public comment in November and the plan that was submitted for public comment in January were very, very different. And what changed was that announcement of the $1 billion projected shortfall. And so I think I think your feelings are very, very valid. And I agree with you. I want to make sure that individuals' input is listened to as well. So I agree. Um, Somebody saying, I think a lot of what's being suggested is already possible. It's just that access is cumbersome, staffing isn't available. Things like transportation can, in theory, cover Uber rides, but nobody offers that. Noise canceling headphones are an option under specialized medical equipment, but it can take a year to get them, and the cost is double the retail expense. Home mods are similar, and families often complain the quality is lacking. I'd love to see improvements on what we already have. Thank you for sharing that, and thank you for detailing that, because that's the type of thing that we need to hear. Let's see. Um, it would be great to find out when the state plans to submit the plans to CMS. It'd be nice if the state shared it with you before submitting. You know what? We are going to keep everybody up to date on all of that. If you are not already on our e-newsletter, go ahead and subscribe to our e-newsletter. We only send it out once a week, so it's not going to clog up your inbox. If you that way you can stay up to date on all of that. We do have a page dedicated to waiver changes on our website. Right now, it's dedicated to the changes with those skilled nursing waivers, the pathways for aging, health and wellness, and TBI waiver, because that's where the most of the changes have been. Some of the changes that happen with family support and CIH are also on there, but stay up to date on all of that. And I am going to make a shameless plug. The ARC is a membership-based organization. And one of the reasons the state listens to us so much is because we can say we have 35,000 members across the state of Indiana. So if you are not already a member of the ARC of Indiana, consider joining the ARC of Indiana. If you have a local chapter in your community, if you become a member of your local chapter, like the ARC of Greater Boone County or Noble of Indiana, or Logan Center up in South Bend, Stone Belt down in Bloomington. If you have a local chapter of the ARC, if you join that chapter, you are automatically a member of the ARC of Indiana and automatically a member of the ARC of the United States. So I'm going to make a shameless plug. Become a member of the ARC. Stay up to date on everything that's going on. We're definitely going to keep you up to date and let you know exactly what's going on all along the way so that you are included, so that you can make sure your voices are heard. So, okay. So I'm looking to see if there are some other questions. And it looks like we have gotten quite a bit of that. But again, like I said, if you're anything like me, you're going to think of something later on. Give us a call here at the ARC. Talk with one of our family advocates. You can reach us at 317-977-2375 or 1-800-382-9100. Everyone, thank you all so much for all of your input. You guys have shared some really, really great information, and I am so grateful for everything you have shared, all of the ideas you have brought, the concerns you have brought, and most importantly, the experiences that you have brought in all of this. So thank you so much for all of that, and have a good evening. Good night.